Hi, I'm Dr. Gonzalez from the Performance Place. Today we're going to be going over SLAP lesions of the shoulder. We're going to go through some anatomy and show you some anatomical landmarks you can use to figure out what is your actual condition so you can report back to your doctor and give them some educated feedback so they can properly diagnose you. Before we go into the anatomy, I want you to realize what a SLAP lesion is. It's actually just a tearing of the labrum. It's called a superior labral tear, anterior to posterior. It's usually in the backside here, and we'll go through that on the anatomy again. But just realize that it's actually a tearing away of the cartilage or a defect in that area. It's a lot different than a tear to a rotator cuff tendon or a muscle, so it's important to realize there is some aspects of instability, and this condition is a little harder to treat than most musculoskeletal conditions. Going through the anatomy here, let's start with the clavicle. If you palpate this way, you'll feel something bony, and it goes all the way and drops off into this part where it gets a little softer right around the deltoid. This is called the acromion process. Right just posterior to it here is a common spot for pain of a SLAP lesion. Although this is the probably pinpoint spot that I'd say a lot of people have, SLAP lesions can have a ton of different things which it can mimic. If you move back this way, you have the spine of the scapula going this way, which this is hard ridge. Just inferior to it is the infraspinatus, and the tendon comes this way. So again, it crosses right around the same region, and there's different depths that we need to accommodate for. And again, this is a condition that can have many different aspects to it. If we did a speeds test, you can push on here. This contracts the bicep, which contracts the tendon, which then pulls on that portion of the labrum and creates pain. I've seen different people come in with pain all generalized up here as well as back here and as well as down here. So you can have lots of different symptom patterns with this condition. A SLAP lesion will feel like pain in the posterior or backside of the shoulder here, which we'll show on the picture. It is commonly found with biceps tendonitis. I believe the number is about 50% of people with biceps tendonitis will also have a SLAP lesion. There's a positive test called speeds test where you basically push down and you contract the bicep and it creates posterior shoulder pain. Those are the most common tests to do with it, but to actually properly diagnose it, you're going to need an MRI arthrogram, which is an injecting dye within the shoulder joint itself, which inflates the joint so you can see the actual tear of the cartilage off the bone. SLAP tear treatment is actually a fairly complicated topic, and the reason is because, and I'll go over a couple stats here, but for the most part, people do respond okay to therapies such as active release and strengthen the shoulder girdle and all the types of things you probably heard about in typical offices, and also some of them do need surgical treatment. I believe the numbers are, one study I saw was in 2010, about 71% of the people in the study had successful treatment, and I believe that it was about 66% or 61%, something around there, actually were only able to return to play at their prior level. So if we're talking about can you do what you wanted to do, if it was playing baseball, maybe, we'll see. And it's also important to note with that study that 51% of the people who had successful treatment actually opted for surgery afterwards, so it's a little bit skewed in numbers. The surgeries actually seem to be doing okay, and there's lots more current research than I would probably cite on this video, but one in 2001 stated that basically I think it was like 80% of the people were happy, and I think only half of those were able to return to play about what they wanted to. So again, comparing those numbers, they're fairly about equal, so you might want to do your own research on PubMed. The reason it's hard to treat is because the cartilage in the area actually is not very vascular. And the reason this is important is because blood flow is important for healing of areas. If we consider muscles and tendons, they're a lot more vascular than ligaments or cartilage. Thanks for watching the video. If you really liked it and you like the information we're putting out, please like our video and share it. It's great to get good feedback and good comments on the stuff that we put out, so we know we're doing a good job. Thanks for watching, and if you have more questions, please go to info@p2sportscare.com, or that's where you can email us. The website is p2sportscare.com. Thanks.
Don't forget to check out our ebook at the website below.